folks. Today in the mail at work, we got the New Hampshire Grocers Association monthly periodical. And there was an interesting 3-pager in there, in the magazine, booklet, whatever you want to call it, from the Society for Human Resource Management. And it has to do with H.R. 3590, Affordable Health Care Act, my ass, signed into law 32310. And H.R. 872, the Reconciliation Act of 2010, passed the House on 32110, and as of 324, it's pending in the Senate. Individual responsibility under the Health Care Act. Yes, requires U.S. citizens to maintain minimum essential coverage beginning in 2014. Individuals who do not purchase coverage will pay the greater of $95 in 2014, $495 in 2015, and $750 in 2016, or up to 2% of income by 2016. Families will pay half the amount for children up to the cap of $22.50 for the entire family. After 2016, dollar amounts will increase by the annual cost of living adjustment. In the Reconciliation Act, it decreases the flat dollar amounts from $495 to $325 in 2015, and from $750 to $695 in 2016. Raises the percentage of income assessment from 0.5% to 1% in 2014, and up to 2.5% in 2016 and subsequent years. Liking this yet? Employer responsibility. No requirement to offer coverage, but all employers with more than 50 full-time employees that do not offer coverage and have at least one full-time employee receiving the premium assistant tax credit would be required to make a payment of $750 per full-time employee to the government. If an employee opts out of an employer plan because the premium would exceed 9.8% of the employee's income and receives a tax credit, the employer assessment would be the lesser of $3,000 for each employee receiving a premium credit, or $750 for each full-time employee. Employer health care coverage must have an actuarial of at least 60%, or penalties are assessed. That's really going to help small business now, isn't it? I work for a small business. We do have over 50 employees. We don't have 100, and we're at 8 locations right now. The House Reconciliation Act amends free rider assessment to require employers not offering coverage to pay $2,000 per full-time employee, even if one employee receives a subsidy and purchases coverage in an exchange. The first 30 employees, however, would be excluded from this calculation. Employers offering unaffordable coverage would be assessed a $3,000 penalty for each full-time employee that receives a subsidy and purchase coverage through an exchange. Coverage is considered unaffordable if the employee's premium exceeds 9.5% of family income. The employers are getting screwed in this one. In addition, employer penalty. In addition to the above, an employer with more than 50 full-time employees that requires a waiting period before an employee can enroll in health care coverage will pay $400 for any full-time employee in a 30 to 60 day waiting period and $600 for any full-time. The first bill was trash. This reconciliation bill really does nothing, and I do mean nothing. Let me tell you what the problem is right now, folks. I've been with this my employer for well over 10 years. And he's had many, I remember days when he didn't have health care coverage. Things have gotten better. He's offering it. And it weren't so bad. Well, I got married. My wonderful wife's a nurse at a local large hospital, and she's got much better health care plan than I did through my employer for a bit cheaper. And I dropped my policy and went on to hers. In the past 5 years, through my employer, 6 years ago he went with Anthem, and a year after the policy was in effect, they got approved to raise rates by 40%. Well, before that could happen, he changed over to Pilgrim. And we had them for a couple of years, and then they were approved to raise their rates by 50%. His current insurance provider is MVP. And before this damn health care bill passed, they were approved by the state to raise the rates by 60 some odd percent. That's a rough figure. It's right around 60%. At the same time, I heard states using Anthem as their provider, and they were approved of a 65% rate increase. The problem here is not employers providing. It's the cost of health care, insurance. My wife, when she first took up a job at Dartmouth, we paid a good penny for it, but we had a zero deductible. They jacked the rates on that policy so much for the hospital, which, it's affiliated with Dartmouth College, the medical aspect of it, that suddenly there was a small deductible. Well, it's gotten larger, and we seem to be paying even more now than when we had no deductible. I didn't go to the doctor any more then than I do now, but the rates keep going up. What the fuck, folks? This is a mess. Leave your comments down below. Send me a video. I approve all videos. I don't proofread them, proof watch them. You got free speech here. Please speak out. Peace out.